Derek wakhathi ngithole 2003 ukuthi ngine HIV. Ngo-2004 ngaphathwa i-TB. Bangithatha bangise Santa ngahlala khona for 4 months. Mangabe ngifika ngiyokwenza i-x-ray bangitshela udokotela ukuthi iphaphu ngempela lilona liselidlekile lilaka right. Qala ngomhla ka9 June ngasebenzisa ama-ARVs. Hayi akushayisana ukuthi nje kuphela kana anama side effects kakhona kodwa ke ngiyazama. La senza i-cotton wool. Supplyela ama hospital, ama clinics ney'nkampani ey'nkulu. Ngempela la ngisebenza nje ngoba naku phela ke ayikho into engingayenza ngokomthetho ngendlela ngcole ngakhona ngendlela yokudusting ngakhona kodwa ayikho into engayenza indlela yakhona u-cotton wool uyangcolisa njengoba nje kubonakala nalapha phansi uyangcolisa u-cotton wool. Lena ke i-mask yami ngenzela i-dust ayisebenzi impela ukuthi ingangeni nakuba ke kodwa kuba lukhulu ukuthi mangiyisebenzisa le mask ngiyifaka la ngokuthi manje iphaphu linye kuba lukhulu ukuthi ngidonse kahle umoya. Sometimes ngiyayifaka yona kube mhlambe noma 2 minutes and then ngibuye ngikhumule ngidonse i-fresh air and then ngibuyisele ngaphakathi ngibuyisele emlomeni kuyashisa kakhulu kuzobe kuhambisana nale dust ke le khona.
When he came back after the TB, he was actually in an environment that had a lot of dust. We've actually taken him out and put him in an environment where he is, which is basically more heat and less dust, which basically gives him a better chance on the work environment, so he actually can perform with the disability that he does have at the moment.
Akumnandi ngeke ngize ngisho ukuthi kumnandi ngoba nabaphathi bayo ifemu akubona abaphathi okwazi usebenzisane kahle nabo.
Derek is employed here primarily as a boiler attendant. He works in an environment that's quite hot, so he does from time to time works under constraints that I would consider for normal people to be very difficult. But I think as you've seen today is that Derek, even with his HIV status, is reasonably healthy even under those circumstances.
Boss ephethe lekhaya mina yangitshela nje emakhaleni yathi ngangingekho sikhathi wenza ngisaluthola le HIV yakho ngangingekho so ngifuna wami umshini uhambe sho ngaleso sikhathi ngangiphethwe ikhanda kakhulu ngahamba ngaya eKingedward iambulance yafika yangithatha lebusuku ngangenza night shift yangithatha iambulance ngakusasa kwabuya iphepha lalikhombisa fanele ngikhokhele leyo mali 850 rand. Mangithatha leli phepha ngoba khombisa management ukuthi nanti iphepha le-ambulance fanele likhokhelwe bathi ayi bayikhokheli.
I'm Firoza Mansoor. I'm the National Director of the SACTWU AIDS project, and today we're visiting a company called Ninian and Esther. The company has elements of a wellness program in partnership with the SACTWU AIDS project that presents a good example of what companies should be doing on the HIV/AIDS issue.
My name is Ben Kama. I'm the Human Resources Manager for the Clothing Division at Ninian and Esther. The division employs about 694 people, and we came about with the HIV/AIDS policy based on the fact that we knew and we accepted that there was this pandemic and everyone had to do something about controlling what was happening.
Sunita, tell us, how's the training program going?
Since our last meeting, Firoza, the program has gone very well. We have completed the shop floor people's training. We've also done people from the packaging department, the dispatch, and the office staff. Our peer educators are very good at what they're doing at the moment because they're also encouraging the staff to come into training. We've had a lot of reluctance initially from the black males in the dispatch area, But since the peer educators have been talking to them in their tea breaks and that they're now quite comfortable to come into training and sit down quietly at the back, and they also get the same message that other people are.
I'm Sister Lindiwe. I'm the occupational health nurse in the company. My main emphasis is on HIV and AIDS awareness. Keep counseling people on a daily basis and refer them as they need to go for testing.
We have since, after training, embarked on voluntary counseling and testing, whereby we send our people to SACTWU offices where they undergo the counseling and testing. And this is done during working hours, and we pay them for that.
More and more people are coming now after we've done the HIV awareness program, which we covered earlier this year. So from the knowledge they had there, they began to understand why is it important for them to be tested. So I get more and more coming forward for testing.
What do you do when somebody's HIV positive?
The company has given me permission to give them multivitamins, vitamin B, Bactrim.
As a primary package of care?
Yes, as a primary package of care.
The company is strongly considering having its own antiretroviral rollout, and there has been a budget allocated for that. But again, we wouldn't go on that on our own. We want to go hand in hand or with the assistance of SACTWU.
I've just seen Sister Lindiwe and I'm now off to Volton Hall to get tested. This is the driver provided by the company for this particular visit.
Abasebenza abaningi banenkinga yokuthi bezela eclinic bazotesta ngoba banaso isikhathi. Kodwa emseni owenziwe uninini lista ukuthi adedele abantu bakhe kusukela ku2 beze bazotesta abatransport ngemoto zakhona bese besuka la eclinic liyami sebegoduka kwenze umehluko kubantu abeza bezotesta zakhuphuka inamba zami.